We good? Ooh, sorry. We obviously are good because I can hear myself. It's always painful. Hi, everybody. Oh, here's my other pen. There we go. Well, first of all, let me just say hello. I'm Gina McCarthy, in case this isn't the 12th time that you've heard me say that. And I'm the managing co-chair of America is All In, and I'm excited to be here on the first health day ever at a COP. Woo! And I know we have a great panel today who is going to help us frame the connection between climate and health, which has always been the same thing. And so just let's make that clear. But also to talk about the ways in which, we can take action on climate that is so much smarter, so much able to really explain to people that climate change isn't a planetary problem, it's a people problem. And we have the ability to design climate strategies that are targeting improvements in health. Because when people start seeing their lives are better, they will want to do more and more and more. And I think that's the whole ball of wax. Look, people, as we all know, are dying, not just from greenhouse gases and the climate chaos that it creates, but because of the associated pollutants that are always tagging along with greenhouse gases. And inevitably, we have to relinquish our dependence on fossil fuels if we hope to make people healthy, if we hope to address the climate challenge. And so we're going to have an opportunity to take a look at the state of global air quality funding 23. If you take a look at it, you'll see that a lot of people are focused on this issue. Health is a big factor in a big constituency that we need to bring into the tent. And we have a great opportunity today to hear about a new report that takes a look at the health impacts related to climate change. And so we'll be able to look at that, and we have a wonderful panel. So we have an hour to take a look at this discussion in a way that I hope will bring to life this intersect between climate and health and get people understanding that these challenges are fixable. We have solutions now. We should leave here being the biggest climate optimists and champions that we can be, because that is how change happens. And so we just talked to mayors because mayors are it. If you want to start from the bottom up, they're the ones that always juice the skids and make things move. And so I'm excited now to have some professionals here that are doing work at every level, that understand the connection between climate and health, and make that clear to all of us. Because really, it is time to relinquish our addiction to fossil fuels and recognize that we have a clean energy transition that we can grab with both hands. And we're going to do that because it's going to save lives. And it's going to give our children and my grandchildren the future that they deserve. So thank you very much. And let's start. All right, let's ask Leanne Randolph, Chair of the California Air Resources Board, better known as CARB. Is how I say it. She may say carb. I say carb. Come on up, Leanne. Oh, it feels like I'm on a game show. Shelley Slanker, who's the Chief Advocacy Officer at Common Spirit Health. Thank you for being here, Shelley. Really appreciate it. You're always coming to these things, and you're awesome. Oh, Dr. Gara Basu, who's my man, Director of Education and Policy at the Center for Climate, Health, and the Global Environment at the T.H. Chan School of Public Health. And I'm so excited to have you all here. We're going to have a great conversation, and I'm going to sneak down here. But before we do, I'm going to ask Raina Sui to come up. She's the Research Director for the Center for Global Sustainability. She's going to present an air quality report that the center has actually produced so we can have a good framing of the challenge that we're facing. Come on up. Yep.
Yeah, thank you, Gina. Also want to thank you very much for all the positive energy encouragement you bring in your remark to kick off the session. I think it's really special. We are launching the report on how we can get improved air quality and health benefits in the United States through all-in climate action. It is also, Gina mentioned, it's the first ever health day at the COP. So it's really a showcase of how important to discuss the two topics together. We need to talk about those jointly because it's highly related. So the report I'm going to present today very briefly is led by a research team at the Center for Global Sustainability at University of Maryland and also our colleagues at Princeton University. So for those probably new audience in this room about hearing all of society approach, just want to add a little background. What we have looked at in the past few years is really how a law-in approach can help the US to get on a path to achieve its NDC targets 2030 by reducing greenhouse gas emissions by over 50% from the 2005 levels, integrating all the actions from all the actors. Because there are a lot of strong evidence, the synergies between emissions reduction in air pollutant emission, but also greenhouse gases. With the strong basis we set up through the all-in work, we can now explore different components of the topic. And because as of today, even in countries like the United States, where air quality and health has improved tremendously since the Clean Air Act, according to the American Lung Association, even today, 36% of US population still live in areas with unhealthy levels of air pollution. That is nearly 120 million people. And there's a lot of kind of also high disparity related with the issue. So in this research, we are going to assess how the all-in approach can also help us achieve better public health outcomes on a county-by-county level. So to do that, we coupled several well-established analytical tools so to allow us quantify the health burden for 10 different age groups in over 3,100 US counties under several different scenarios. So particularly, we're looking at first a counterfactual scenario. There's no climate action, just want to compare to understand what are the effects of the policies. And a scenario with existing policy that include from the federal level, like the IRA, and also renewable portfolio or EV sales targets from the state, city level policy. And then the all-in scenario, I already mentioned, it with enhanced action from all the players that can get us to the 52% reduction. Then we start under each of the policy, we do the economy-wide transition modeling to get the future emission pathway, both greenhouse gases and air pollutant emission. With the emission pathway, we use an air quality model to quantify the ambient PM 2.5 concentration level. Finally, to conduct the health impact assessment to quantify the health burden for all the age group and each of the county. This is measured in premature death. So just to jump into the results, I think we find a very positive health outcome under the policy scenarios. So start with just implementing all the existing policy. So what we're seeing are on the top panel, the annual death in 2030 under each of the policy scenario, but also the cumulative death impacts during a period between 2024 and 2035. So by implementing existing policy, you're seeing the difference between the first two bars. We already can reduce or avoid the death by 3,300 in 2030, and also associated with a cumulative impact of nearly 36,000 avoided deaths through 2035. If we further enhance ambition, making additional effort in the climate transition, we can see additional 2,100 avoided deaths in 2030 under the all-in scenario, and that associated with additional almost 28,000 avoided deaths during the cumulative period. And also, very importantly, I think we want to make sure the better health outcome can be extended to every state, every county in the United States, and that's the all-in approach is very important to help us achieve that. So starting with the air quality improvement, we are comparing in 2030 between the all-in scenario versus the no climate action scenario. We are showing on the upper left in green are the different level of CO2 emission reduction, and then on the bottom right in purple, different purple, we're showing the percentage change in PM 2.5 concentration between the two scenarios. So with different level of CO2 reduction, depending on the state's current energy structure, we see up to 18% reduction in the average PM concentration level across state. I think the highest is in West Virginia, and followed by Pennsylvania, Maryland, each reach 15% of PM concentration reduction. And when translate that into the health improvement outcome, now we're showing all the over 3,100 counties in the U.S. That from the exposure to better air quality to health outcome, also depending on a lot of the kind of social demographic characteristic in each county. So we see over 2/3 of the county can have improvement in better air quality by 5%, and 1/3 of the county can achieve greater than 10% of improvement in their public health results. So you can see the darker color shows you the greater improvement, mostly concentrated in the Midwest and also Northeast region. A lot of our co-producing and consuming counties with energy transition, they got large improvement in air quality. Also want to call out some of the population dense region in Seattle, metropolitan, and also San Francisco, Los Angeles, kind of the greater area with large population. Before I end my talk, I want to really highlight the equity perspective of the health issue. I think we do see this universal improvement in every state, every county about the better air quality and health outcome, and they're all in. But we do observe the air quality disparity between different parts of the community gonna persist. Also, similarly, while this report focuses on the outdoor air quality issue mostly, I also list a lot of other climate-related health issues. I think they will also place an equal burden on the diverse community, especially on the low-income group and different ethnic groups. So I think that's where the all-in approach can be also a powerful tool as we work together on different parts of the society to design targeted strategy for specific locations, sector, and groups, but also ensure comprehensive implementation so everyone can get access to the better benefits that delivered by the transition already happening now. With that, I think I really look forward to hearing from the great panel, excellent panel. I think a lot of the kind of elements we can go deeper with all of your great work and expertise. With that, I will just hand back over to Gina and to lead the panel discussion. And thank you. Yeah.
Thank you, Rena, very much.
Report is already live, so feel free to download and read it. Thank you.
You know, that's what's good about doing these events with Mike Bloomberg's help, because he lays out the science, and then he picks the best people in the world to actually make change happen on the basis of that science. And so I'm excited about it. Thank you so much for sharing it. Let me just give you one not so fun fact to translate from what's happening in the US to what's happening worldwide. Just to make it clear that over 99% of the people around the world are breathing air that exceeds WHO health-based standards. 99%. Right? And air pollution causes 7 million premature deaths every year. And that includes more than 500,000 children under 5 years old. These are staggering figures. So I know we have challenges in the US, but when you look at this from a global perspective, these are not challenges, these are devastating numbers. And we have to get better. But one of the good news is that every action we take to reduce climate change is action that is going to reduce the other pollutants that are harming people. So we have the opportunity, frankly, of their lifetime to deliver for them the kind of future they want. So let's have some fun with this. I mean, let's not be depressed as much as I just depressed myself. Let's make sure that we keep moving forward and keeping our chin up. And can I call you Leanne? Because thank you, Leanne. I know we've met before, and I know I'm very familiar with CARB, but I also know that California's really done some groundbreaking things to actually address the air quality challenges that they have, and how many lives have been saved because of the work that you and your team have done. So first, let me thank you for that. But do you have any other thing you want to offer in terms of specific case studies or best practices that really demonstrate the opportunities we have to do better?
Yeah, absolutely. Thank you so much for having me on this panel. You know, the Air Resources Board is at heart a public health agency, and doing that work around both core air quality regulation and climate, that intersection is so important. So I'll just give a couple of examples. First of all, so we do every 5 years we adopt a climate change scoping plan, which lays out the strategies we need to achieve our 2030 targets, and this past plan gets us to carbon neutrality by 2045. And our mobile source regulations are a critical piece of that climate strategy, and they're also a critical piece of our public health strategy. In particular, we recently adopted Advanced Clean Fleets, which is a companion rule to our Advanced Clean Trucks rule, which really digs into transitioning the medium and heavy duty sector to zero emission. And in California, that is so critical. 40% of the goods in the US come through the ports in California. And so those ports are located in communities with vulnerable residents. The goods get on trucks and they go through the valleys in Southern California and in Northern California and impact residents in areas of non-attainment. And so that air quality strategy also had huge climate benefits to move us away from diesel and to zero emission vehicles. And in building that rule, we prioritized in particular the drayage fleet, those trucks that go from ports to warehouses. And so the rule covers all manner of medium and heavy duty vehicles, but the first deadlines apply to those drayage trucks, because we know that that has critical health benefits to vulnerable populations. Then the second example I'll give is the fact that we in California are both mitigating the effects of climate change and adapting to those effects. And wildfire is obviously a really important, challenging issue in California. And so the Air Resources Board is working a lot with thinking about the impacts of wildfire smoke on communities, helping residents learn how to learn what they need to do to protect themselves from wildfire smoke, and working with local governments and the legislature to do things like have community resilient centers where people can go if there's a wildfire, and if they don't have air conditioning at their home, they have some place to go to get away from the smoke. Because we are trying to protect public health as we're grappling with that climate change crisis. So those are a couple of examples to share.
Well, those are great ones. First of all, transportation is the big kahuna. People don't, I think, realize just how much of the emissions that are impacting our climate are actually coming from transportation. But the drayage trucks have always been a huge challenge, and so I thank you for that. And raising the fire issue, I think, is really important. You know, I live in Massachusetts. I have never, ever experienced smoke from forest fires in Boston, Massachusetts. But when Canada was on fire, it was everywhere. You know, it just gives you a sense that there's nothing that's protected if we don't fix this. You know, so it's amazing. You know, can I ask you one more question? I know that Cobb is uniquely situated to really focus on the public health and associate that with how to address the climate crisis at the same time. I'm frustrated in many ways, but we'll talk about that later. But I'm frustrated on the fact that I think many of the strategies on climate never articulate the benefits to health. Yeah. They don't focus on how do we maximize that at the same time. So to me, that's sort of your mission, right? Yeah. So how do I make that everybody's?
Yeah, no, that's a great question, because, you know, when we do our rulemakings, because we have been doing this for so many years, all the way back to the catalytic converter, you know, we are used to quantifying the public health benefits of particular measures that we take. But that's not always true. And sometimes it's really a matter of linking sort of government agency strategies with researchers and the public health community to make sure that there is a public articulation of, you know, here is how, as we transition a refinery from diesel fuel to renewable fuel, you know, what are the public health benefits of that we can articulate? And so that messaging, that communication of the various climate strategies that have a public health benefit, I think is just so important.
You know, I'm on a mission to make that always happen, because I think it's the only way that people are going to really internalize this challenge, instead of making it somebody else's problem out here. You know, nobody's doing it on purpose, but you got to internalize this, and it's got to become personal. And I don't think there's much that's sort of left to chance. About the fact that we can solve our health crisis if we fix our climate crisis. You know, there's just a wealth of opportunity. Leanne, you're a terrific spokesperson for that in California, and I just thank you for all the work. Cobb has always been on the front line of these issues and pushing the envelope, and it's so great to see you there and continuing that history. Really.
Thanks. We have an amazing team. We have an amazing team at
I know
CAR.
you do. Damn it. I know you do. You've been beating me up for a lot of years. I'm telling you. Rightly so. But we've been trying. I've always been trying to do better. But Shelley, why don't we jump to you for just a little bit? You know, as Chief Advocacy Officer, I think you've been moving Common Spirit Health in a direction to really integrate climate into its mission and values, which cannot be easy, because it's always challenging. Can you talk to me about the road you took to get there? How did we manage to sort of integrate this thinking into an organization that wasn't used to thinking that way?
Well, for us, we're a faith-based organization, and the women religious who sponsored and founded our organization have actually called us to take care of the planet for decades. So our climate action sort of came out, I like to say this is part of our DNA. Our goal to be net zero by 2040 across all three scopes is very ambitious, but they have called us to do it. And to pick up on what Leanne said, 70% of healthcare's emissions come from supply chain. We're heavy supply users and then heavy energy users. Every day in our hospitals, we see patients with bad health outcomes that we know are tied to the climate, but we also have to acknowledge that healthcare in the nation makes up 8.5% of total emissions. So if we have dedicated ourselves to do no harm, first we have to stop harming the planet, because we see health of the planet and health of the people as inextricably tied together. So we've been excited. Our climate action plan has 3 pillars in it. The first pillar, pretty straightforward, buildings and operations. We have 146 hospitals across 24 states and 2,300 clinic sites.
146
Yes,
hospitals?
yes. we are very large, yes. And
Good luck to you doing that.
yeah. Well, and so the second pillar is all around supply chain, value chain issues. But our third pillar is around climate resilient communities. We knew we couldn't have a climate action plan bolted on to what we do, so it's integrated. Our community health people are tying in climate resilience into what they're doing. Our community needs assessments tie in climate. Our operations, our building standards tie in climate. Everything we do, every function, IT and the like, are asked to build it into what they do. So it's not something outside of us. It's just our way of doing business. We're very excited about the IRA, and Mr. Podesta knows I am on one challenge for him. The IRA for old, big hospital buildings is very hard to access because of the 25% threshold. We've been accessing it for other things, but to get in our buildings and do that set of work, we're trying to figure out. I know New York buildings have had the same issue, so we're trying to get there, but very excited.
Well, that's great. I hope you are annoying him with that question.
I am.
Good, because I'll continue to do that as well. The great thing about the way the IRA is being handled with the guidance documents is they're willing to make shifts. Yeah. They're willing to figure out how to make the things that they wanted to accomplish doable under the guidance that they're producing. So it's really kind of fun to watch.
And we've been working with other health systems. We think our job is to get everyone to start, and especially in the early years, taking action actually can save money for healthcare. So changing out light bulbs to LED saved us in just the state of California $10 million a year.
That's a lot of light bulbs.
It is. But then what it does is they're cooler in the operating rooms, so you don't have to cool so much.
Right.
There's all kinds of benefits. And we do a thing called retro commissioning, where we go in and we just make sure all the systems, HVAC, cooling, the whole thing, are at peak performance. You can save 8 to 12% of your energy cost, which in a 24/7 operation adds up to real money real quick. And then we're taking that money and putting it in to the next climate thing we're doing.
Yeah, that's amazing. Congratulations on all that, and we'll keep chatting about it. But one of the things that's really important, I think, Shelley, with the work you're doing, is to make other hospital systems aware. I know that folks get together and they talk about these things. And I know that you and a lot of other hospitals have made commitments at the federal level to work with HHS on this. But do you ever tell your patients that this is something that you're thinking about?
Actually, we do. We
I
have
thought you would.
trained Right now, we're a little over 2,000 physicians who have gone through a sustainability climate training that's 3 sessions of multiple hours to train doctors how to talk to patients about asthma being caused by climate and other things. So we're trying to embed it into the clinical care. It takes a lot. Doctors are trained to just get in, get out, do the clinical piece. But if they can broaden that scope, they'll help all of their patients.
Well, that's probably a good segue to Garb. There's, I know that you've been working on issues related to climate and health, how to communicate that effectively, but also, folks like Ari Bernstein has been really trying to do what you're talking about, which is to really integrate these considerations. Like I'm trying to get when you're working on climate, consider air quality, consider public health. It's the same thing for physicians. And I know at Harvard, at T.H. Chan, I mean, there's a lot of really great scientists and researchers there. They don't end up being the best communicators. So tell me how you do.
Well, I've learned a lot from Eugene on this. And I mean, it is striking to me. I think we need to marry the storytelling and the data together. And I think a thing really, I think no one does it better than you is this basic thing of making it very human. Like I want people to close their eyes and picture the kids, and not move away from that, because that motivates you in a way, and that makes you realize you can do it and why you're doing it. And I think that the storytelling, it brings people together, it breaks down the polarization, and it allows us to kind of understand why we're doing this. And I mean, part of it, my clinical assessment is that air pollution is gross. It is something.
That's pretty clear.
I want to make the point of just, and Rena, really striking study here, and I really compliment you for that. Air pollution impacts all of our health. Especially this particulate matter 2.5. It's like 1/30th the diameter of a hair follicle, so it's tiny. So it can embed into deep parts of your body. It goes into your lung. I mean, I sometimes just scan the body and think about, all right, brain, strokes, dementia, childhood learning, Parkinsonian, heart attack. It truly impacts all the things I care about as a primary care doctor. And you're right, now we have a 4-year curriculum at the med school trying to integrate, how when you're learning about asthma, get it in there. We're talking about cardiovascular, heat, air pollution, all these elements. It has to be a lens. It has to be a muscle. Because how foolish is it if we are changing the asthma inhalers and we didn't ask them that they're living right by a highway, right? That's not good medicine. And we're not communicating with our patients well. So, we need to have the skill sets to communicate with our patients so that we can help them understand why they're going to feel much better if we address air pollution. And then you got to communicate into the public of why all the stuff this panel is doing is fundamentally a health and medical intervention.
One of the fun things that I learned in doing some of this work is that nurses are really good spokespeople for this. I mean, they are very aggressive. They get together and they start making demands. And I can remember how difficult it was, not 8 years ago or so, just trying to get Harvard Medical School to think about doing more than a seminar once every 5 years on this issue. That may be a little extreme, but not much. How is it catching on at all to actually build this into the system?
I mean, there's just the exciting stuff is students really get this. There's a hunger for it. They pushed our leadership at the med school, the public health school, to really break through. So, I mean, there's never been more interest in this. People understand the structural, like all the pieces of it all together. Hey, it doesn't make sense if we're building unhealthy things, right? Having healthy environments and societies and infrastructure is critical to my job as a health professional. And yeah, nurses, primary care doctors are among the most trusted spokespeople for climate solutions. So I think we really want to be on the forefront of ambassadorship, of communication about this, and really be a part of policy as well.
Shelley, I see you shaking your head, nodding your head, I should say, not shaking. You know, so you do the same thing. Do you guys develop joint sort of curriculum? Is there an organization that does that for the medical profession or for hospitals?
I think some of the academic medical centers are collaborating. It's been hard to get everybody sort of on the same page. We really believe it's got to start in medical school. I mean, we're training some of our existing doctors who are out of school, but it's when it becomes a part of it. So we work with Creighton University as well as Baylor St. Luke, and that's where we're beginning to have the classes and build it into the curriculum.
That's great. And, you know, let me jump back to CARB for a minute, if I could, Leanne, because I think both you and I have been in the sort of regulatory world for a while. You know, some of the best things that we could ever do was to just, you know, the best we could do was to just put a cost on how many people died or were injured. Not the best statistics that you want to go to sort of make this a personal issue. So I know that CARB has been very aggressive, and it's challenging because California is a big place. You have some pollutants that are coming from other countries. You know, it's not all in your control. So how do you prioritize? How do you think about what's next and the next thing that's going to drive health benefits?
Yeah, you know,
it can't just be about money, right? There's something here.
Yeah, no, that's a great question. I mean, one of our challenges is that many of our pollutant sources are federal sources, and we are constantly talking to the federal government about, hey, what can you do?
I am no longer in the federal government.
I know one thing that was very exciting is the endangerment finding on leaded aviation fuel, on avgas. Like, when I started
at CARB, how long that took to get done? Like it's a surprise. We knew this 30 years ago. I know. I'm
like,
sorry.
There's still lead in this general aviation fleet fuel. It's insane, right? But there's a lot of progress we can make on locomotives, on interstate trucking, and one of the areas that we are really looking into is indoor air quality. Yeah. You know, as we are thinking about moving away from fossil fuels, sort of identifying the public health benefits that come from maybe not pumping natural gas into your house, and
you trying to take away my my gas
stove?
Is that it? That was a joke.
And really understanding like the benefits of switching, you know, fuel switching to electricity, to cleaner options, has public health benefits, and identifying and quantifying and doing the research, compiling the research, communicating the research. Yes. Every year we give awards to leaders in public health and climate and environmental justice, and one of the awards we gave this year was a researcher doing indoor air quality research, and you know, quantifying the impacts of gas appliances in homes.
Oh, wow.
And you know, getting that information and that data out is just so important for climate action.
Well, we look at it kind of like carrots and sticks sometimes. We try and be the carrot to get other health systems to join us, but we also need sometimes the regulations to be the stick. And in California, we just passed SB 253, which requires any company over $1 billion to report carbon to the Carbon Disclosure Project, and sets them. So when we look at changing the supply chain, we've been working with our top 100 vendors and moving things along. You'd be surprised how much more interested they are in meeting with us now that there's a bill that says they have to report.
It's an attention getter, huh?
It's both.
Can I just make one point explicit? I think people all know this, but the amazing thing about air pollution is you stop burning fossil fuels, it goes away right away, right? Carbon dioxide is a hard thing, hundreds of years. these studies come out. 1 out of 5 premature deaths. There's a major study from our colleague Francesco Dominici that came out in the last 2 weeks at 466,000 premature deaths from coal-related air pollution in the last 20 years. These numbers, like you said, are humongous, and they can go away very quickly, because air pollution goes away right away. Yeah. So when I think as a doctor, just thinking about what is the most potent thing you can do to take care of as many people, and fundamentally an issue of equity, right? Just completely an issue of equity. I can't think of something more potent across the board to take care of people.
And more important to families.
Yeah.
There aren't that many good things that came out of COVID, but telehealth exploded during COVID.
That's true.
And we learned a lot as health systems. And to your point, how you tell the story. So we try and make it so our employees know, but we've done a little over 3.5 million virtual visits since 2020. And that is and when you take people not traveling to the clinic or the hospital, that is the equivalent of 752 round trips to the moon if you were driving. And, I know it sounds funny, but our staff loves to understand.
That's great.
Or it's 678,000 houses worth of electricity for a year. So when you can tie it to things people understand, they get more excited about it.
Yeah. I know we mentioned the gas stove thing, and I was joking a little bit about the gas stoves because it is one of the crazy things that you hear in Congress these days.
Yeah.
You can't take away my gas stove. I've never had that kind of affection for a thing like that.
We just made our house electric last summer, Gina.
You did?
It was
Yeah,
a lot of fun.
baby.
But it's not just gas stoves, right? It's furnaces
Oh,
that
my
you don't have
goodness,
to pay
absolutely.
attention
Heat
to,
pumps.
right? So just start with your furnace.
I cannot tell you how miraculous heat pumps are.
Heat pumps are magic.
See, part of the challenge I think we all face, at least I think anyways, is that, the IRA the Inflation Reduction Act is great. I mean, $310 billion of investments have been announced, almost 400,000 projects. I mean, we are talking massive investment. But the thing that I don't know whether we've figured out yet is how to get consumers plugged in. Yeah. How do we get it meaningful to them and get them access? And part of what America's All In is they have me jump into Columbus, Ohio, and where'd I go? Florida. I go everywhere, just talking to get people excited about this. Yeah. But it's consumer stuff that we have to get them. If it's in their home, they're going to talk about it. Yep. You know what I mean? And that's your point. Mm-hmm. Yeah, is that it's amazing.
Consumer education is so important, for instance, to the point of okay, if you don't want to get rid of your gas stove, that's fine. Focus on getting a heat pump and getting contractors and installers to talk about it, getting kind of the word out, because the challenge is, right, you replace an appliance usually when it breaks, and you want to move fast. Yeah. And if you don't have the information there, then it's more challenging. So we, in California, we actually recently got together with some philanthropic donors and manufacturers to form a nonprofit entity to kind of educate around heat pumps, because we have a similar organization in California called Veloz that educates around electric vehicles. They were the ones who did the Arnold Schwarzenegger commercials about electric vehicles, and we're like, hey, why don't we do that for heat pumps? I don't know that we can get a celebrity, but
you mean the EV Hummer he's driving
right,
now? Yeah, that's
right.
so funny.
But it's that public education component is so important. Like, here is something you can take that is health protective, and here's how you can do it.
So was it hard or easy or hard to get your home all electric?
It wasn't that bad. They got the hardest thing was getting that connection to the utility line, but everything in the house was 3 weeks. It was fun. We had a good person doing it, but you know, you think so. Most air pollution that people are exposed to is indoor air pollution, and you know, NOx and other air pollutants, you know, have real issues for respiratory disease, learning, you know, cognitive development and all that. So you think about all that. But to the point, you know, I do think that. The quiet stuff in the background with building codes, energy efficiency we haven't talked about much today, and you know, in Massachusetts now we have that pilot 10 cities all electric stuff.
Yeah.
So I do, you know, I think buildings are hard to kind of get into the guts of the house and you know.
We got whole
to-
communities going geothermal.
Yeah.
Whole
Yeah.
city blocks.
But I think you need that quiet regulatory policy to say, hey, when you build new stuff, it's got to be all electric. And can I be honest? Also, it's kind of boring. You know, it's just it's like I have a heat pump furnace, and I turn the water on. It's warm. I mean, it's not. It's such. We make it such a leap, like it's a futuristic thing.
That is not
It's not that
boring.
big a deal. You know.
It's great. Well, I think one of the challenges, the earlier panel that we had, there were community college folks involved talking about doing training for young people. I think one of the things that I have seen in Massachusetts is that, you know, the guys that are used to doing gas or oil, they tell you how horrible heat pumps are. Yeah. You know, there's a lot of protecting of turf. Yeah. And misinformation, and I feel like there needs to be a lot more, you know, training of young people in these careers, which is what's beginning to happen, but a lot more challenges about how to educate people so that they recognize that if they're hearing this kind of thing, it's not real. You know, I was just with Governor Mills from Maine at the New York Climate Week, and and don't quote me, but it's more than 90% of homes in Maine now have a heat pump.
Yep.
They went all in. Now you're seeing other states picking up the challenge.
Yep.
Heat pumps are miraculous. Mm-hmm. One of the reasons why I love them is I don't understand them at all. I don't know how they work. I just know they work. Yeah. But I have faith. Not others do. You do. Yeah. Which is great, but we have to get people an understanding of how these things work so that they don't think they're being cheated.
Well, what Maine has done has been amazing. So I was at the announcement when New York and Maine and Washington all committed to a heat pump goal. And, you know, in Maine, they went all in. You know, they provided funding, they did education, and they just went out there and said, hey, you know, here's how you can get a heat pump, and this is how you're getting off of heating oil. I mean, it's amazing.
Department of Energy just had this big announcement a few weeks ago, right? With like tens of millions of dollars to build up the supply chains and the production of it, which those are like those quiet announcements that's really changing the availability so that we can get them into the houses.
Well, you know, that's what's really good about what's happening at the federal level now is that really in the Biden-Harris administration, they're just pushing to make sure that there's no way that any agency can avoid looking at the climate challenge and making decisions on the basis of that. And so that's why they're not missing things like supply chain issues. They're forcing them to the top so that you can make sure that you're really delivering. And I think it's going to be an amazing transformation. I think the most difficult thing that we're going to have, however, is in communities that have always been left behind, that continue to be challenged in terms of getting them the information they need to access. And that's a lot. I know a lot of resources are going to those environmental justice communities, but we need more. We need more presence there.
Yeah, in California, we have really made a shift as we think about our vehicle incentives. You know, early in the process, it was all about, we want the technology to develop, we want the vehicles to get out there, so we're just going to give incentives for anything. And now, you know, we realize that we need to focus on folks who wouldn't otherwise buy
Yeah,
an electric vehicle. And so our incentives are now oriented towards low-income residents because that, those are the ones that need support. Like the early adopters will adopt, but it's really getting those vehicles out into the communities. And so the legislature recently allocated $900 million to building electrification or building decarbonization. And it is all oriented towards low-income residents. So the California Energy Commission is administering those funds, and they are developing a program that is, low-income and community-based incentives to provide heat pumps and other strategies.
I wish we could find a better way to make energy efficiency cooler. You know what I mean? It is just, my daughter used to run the energy efficiency program in Massachusetts. She just left that a couple of years ago. But it was always the most boring thing. Do you know what I mean? She's there, how do I make this a sexy thing? I'm like, I don't know. Yeah. How do we do that?
I'm not sure that we've tried.
Yeah,
That's why,
it's
I mean, we talk about it. We try and get our staff energized about it. But again, it's telling the story. Yeah. So, and it's by audience. So our hospital administrators like to hear retro commissioning because they're going to save money on their budget. But our staff wants to hear about it in a different context. So that's why we take it in how many houses you could do for a year or how many miles. Because you have to make it sort of granular so people get a little excited.
Yeah, you have to make it relate. So how are we doing with physicians?
Well,
newbie physicians.
In getting involved with all of this,
Yeah.
I mean, I think that the thing about climate and it can feel abstract. The thing that health helps you break through is it can feel abstract or it can feel vague. Once you start translating into those human and health numbers, and you realize, like what I tell the medical students is, I don't want you to change anything you care about in medicine. You want to be a cardiologist, you want to be a specialist, you want to be a surgeon, that's what you're fired about. You have to, but get that climate and air pollution impacts what you care about in medicine. And once you can, I didn't have that aha moment until I did, right? And then you can't see it, and then you see it everywhere. And again, I think that's the value of health. Is my hope is that you just have that breakthrough, that light bulb, and then you get it, right? And so I don't even care if students memorize all the stats or anything. It's just that connection, and then you're activated, and then you're saying this is a part of my professional responsibility. And I don't have to work hard as a faculty member. They really want that. They get it. They just want to practice.
Are there any really cool community-driven sort of programs that are really making a difference? I'm thinking about heat with the elderly. How are we managing those issues? How are we bringing, visibility to the heat challenge, especially with elderly residents if they're taking diuretics? God help them in the heat.
Yeah.
Do we have any really cool on-the-ground stuff that's being discussed and laid out?
In Massachusetts, Caleb and I have been working with this, this.
Hi, Caleb.
in Massachusetts, where Caleb and I put a grant together working with this local community group. It's not rocket science. It's the basics. I'm a primary care doctor again, and I have to admit I had this big blind spot of, hey, I take a lot of pride in knowing my patients. Do I really understand what their home looks like during a heat wave? And if you start thinking like that, it's like, oh my gosh, that's a dangerous spot to be. And I don't know what to do after that. I don't have the solution of how to make their house better. But Caleb and I worked with the nonprofit that's just getting ACs and heat pumps into people's homes. And we're trying to measure, hey, does that keep people out of the hospitals and things like that? So a lot of this is just breaking out of your silos, going as far as your skill set takes you, bridging to nonprofits, and you said it just right. Diuretics, antipsychotics. There's all these medicines now that are really well studied that during a heat wave cause hospitalizations. You know, we really haven't done the work in medicine to understand what does that mean of how we counsel our patients. But so that means we got to make sure we're doing that work to make people safer, especially nighttime is dangerous heat for babies, elderly, people with comorbidities. So you got to make the house a safe place, and heat pumps can do that.
We've actually started doing heat drills. So hospitals do disaster drills all the time. They used to be for very different things. But now in many of our states, we're doing heat drills for the emergency department because they get overwhelmed and they need to know how to respond and how to cool people the right way. There's a clinician should do that, but you can't just do it if they're having a heat stroke. So it's all of those elements. In a perfect world, and we're working to do our part there, we should know which of our patients have asthma. So if it's a bad air day, they get a text saying, don't go to soccer practice. Or
That's really
if there's
cool.
fire,
That's really
wear
cool.
your mask outside. We should know which of our elderly patients live in places where they don't have air conditioning,
Yeah.
so we can send people to check on them. But that is an evolving thing because it's a one-on-one physician-patient discussion, and it takes time to do the survey or the ascertain it.
I'm sorry, I interrupted you.
No.
There's sections in New York City that have adopt an elderly person. That's not what they call it, but something like that. I'm not really good at those kinds of things. But they basically, people find out who the elderly are who are alone in the community. And when the heat hits a certain level, they knock on the door or they give a call. Because what happens is they don't respond to that. You know, the elderly don't drink water the way they should, or fluids. You know, they can't open their window for relief. That's not going to happen. And if they don't have air conditioning, and so they're building strategically placed, cooling centers in schools and things like that. That is such a little thing that can save so many lives. And it also sends a clear signal that the world's changing, and we have to adapt to it.
And I think the healthcare system should play a role in that, right? So,
Yeah, I do
when a patient with bad diabetes, their labs have shown they have badly controlled diabetes, right? We have nurses call them and say, hey, you haven't come into the clinic. You got to come in so we can recheck and get you the right medicines. We could proactively have triggers saying, hey, these are the patients we'd be most worried about during a bad air quality day, during a heat wave, and call them. That could be the call, right? Where we're proactively, but the healthcare system is often not incentivized to do that, right? So you've got to have the funding and the motivation to staff that properly to get that messaging out.
All right, I know that I've taken the whole time, and I never even opened it up for questions because I really don't care about you people. No, because I got carried away. I'm really sorry. Does anyone have a compelling question?
A good one.
Because there's 3 minutes left. Yes. Compel.
My question is around building the self-efficacy of health professionals. They know it's an issue of climate and health. They care about it. They know how to talk about it through these amazing trainings. But how do we build up that self and collective efficacy, but also the capacity? Because health professionals have many things going on. So we'd love to hear about that.
This is literally my thing. So we actually have a paper coming out in like a month on this. So here's my theory of change. I could talk about this for a while, but I'll say it
Did
briefly.
you set this up?
Is that I think that doctors, nurses, social workers feel burnt out in a chaotic healthcare system, COVID, fragmented. We're not collective. So we have these fellowships now where we bring people together. They feel a sense of purpose and community and feel like they can speak. The funny thing about health professionals is that they have this paralysis of jumping into this work because they feel like it's too complicated and the climate science and all that stuff. There's this perfectionism kind of thing. And I think we need everyone to just realize that the work that they are doing offers value, and that I really believe that building community and having people learn a skill set that they can contribute. We've studied this, and so this our fellowship, it just skyrocketed having a sense of self-efficacy. I think that actually is literally getting that self-efficacy is really at the heart of it for all professions. But to get these health professionals motivated, it's weird that they've got this barrier, but it looks like we have ways to break through that.
Final word, Shelley. Go for it.
One thing we've learned is that physicians are hesitant to ask some of the questions around the social determinants of health, whether it's food insecurity or what, because they don't know how to help when they get the information. So what we're trying to do...
Don't ask, don't tell.
Yeah, well, so what we're trying to do is say, you don't have to solve that they don't have a refrigerator for their medication,
exactly.
but you need to tell someone, and we can hook them up with community-based organizations who can help. But there is that hesitancy. If I ask all these questions and they need help, how am I going to do that? And so it's that piece of the education as well.
Well, this has been an amazing panel. Can you please put your hands together and thank them for all their great work? Thank you. So much.